So the CDC's government initiative is called STEADI, S-T-E-A-D-I. There is the website. You can get all the materials that I'm presenting from the CDC from there. STEADI, Stopping Elderly Accidents, Deaths, and Injuries. Again, this must be coordinated between all clinicians. A primary care physician may be the person that coordinates stuff, but alternately it might be an interdisciplinary fall team. So here is the initiative. Boom, boom, boom. If you downloaded this stuff, great. If not, you can later. So there's 3 parts. Remember I said 3 core things in the title. Screen, assess, and intervene. I think what we've been doing through the years, we screen people, kind of, depends on the setting. We assess, and then we may intervene a little bit, okay? Give them a balance or strength program, send them to PT, maybe look at their eyes. But we haven't, and I think this is true in my own setting, I don't think that we've taken the real keys, all those items listed under treatment strategies. We need to look at all of those, especially with clients that may have any of these risks. So here's the algorithm. Maybe you have it in front of you, maybe you printed it. I'm going to refer back to this quite a bit. Again, this is the key. There is a little pocket size of this that you can download. I've even got that in your list there, so that this will help just keep you aware of what you need to do. So it says start here, screen, available tasks, available fall risk screenings. All of these things are listed. We're going to go through all of this and then add extra stuff as we see fit. But this is the basics that you can use. There's a Stay Independent 12-question tool, which we'll go over in a few moments. And then there's the three key questions that are listed. And then you decide whether you're at risk, not at risk, or your client is at risk, or your family member. As you can see at the left, screen but not at risk. There are still some things to help prevention, education, vitamin D intake, refer to a community exercise program, reassess every year. The nice thing about the algorithm is it really lays it out beautifully, and this has been updated in 2019. There's the screening. We're going to go through all those tools. Doesn't mean that you can't do other tools or other tests, but these are key ones in order to get you to the 3rd stage, which is the interventions or the intervening. And it lists all those items that we talked about just a few moments ago. See the 3 key questions? There you go. 3 key questions for your patients. Any older client that comes into your facility, or somebody that has fallen, or somebody that you just think is a problem, you should ask these 3 quick questions. Do you feel unsteady when standing or walking? You know, and if they kind of go, well, maybe, ding, 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 that's a red flag. Are they worried about falling? Have they fallen in the past year? They may not tell you the truth because they're embarrassed. So you dig a little deeper. How many times did you fall? Were you injured? So there has been research done, and the research has shown that in 2018, there was an article called Innovations in Aging. The results of this revealed that older adults with identified fall risk who had a steady fall plan of care experienced fewer falls, fewer hospitalizations post-steady implementation, and their odds of hospitalization was 40% lower than those with fall risk who did not receive a fall prevention intervention. Now here's the key. They could have only one intervention done. That one intervention can make quite a bit of difference. Just think if the interventions that are keyed in from the algorithm, if all of them were done, what would happen? Regardless of location or disciplines involved, effective fall prevention requires assessing potential risk factors, managing the risk factors, and ensuring that the interventions are completed. I think I just have to use this. Okay. I'm going to go back one more slide. Sorry. Potential trade-offs must be considered. For example, somebody is on hypertension meds. What does that do to their balance? Well, if their blood pressure goes down, they may feel a little bit dizzy, or they may feel a little off balance. So there might be a trade-off. Maybe we need to look at their blood pressure medications and make sure that they're appropriate.